Hello, and welcome to eMediCore Patients Corner series. Today's discussion is on transurethral resection of prostate, or TURP. TURP is one of the most common surgical procedures used in the treatment of benign prostatic hyperplasia, or BPH. BPH only affects men and is characterized by the non-cancerous enlargement of the prostate gland. A common symptom of BPH is urinary retention, the inability to urinate. The physician may recommend a TURP if the patient's BPH symptoms have not improved after treatment with medications, or if the patient has acute urinary retention, recurrent infection, bladder stones, recurrent bleeding from the prostate, or kidney failure caused by BPH. TURP procedure is done under general or spinal anesthesia, where the patient is numb from the waist down. The doctor will insert a small instrument called a resectoscope through the urethra and into the bladder. The resectoscope has an electric wire loop that cuts the prostate and seals the bleeding blood vessels. The risks of a TURP include but are not limited to retrograde ejaculation, when semen does not come out of the urethra during ejaculation. Instead, the semen goes into the bladder and is voided out during urination. This risk, though very common, does not affect erectile function. Urinary incontinence is the loss of the ability to control urination. This risk is rare, occurring in about 1% of cases. Erectile dysfunction, or ED, is rare and may not, in all cases, be attributable to the surgery. Men who have had a TURP appear to have no greater risk of erectile dysfunction than men who did not have a TURP. Bleeding. There is bleeding during and after a TURP. However, the risk of severe bleeding that requires a blood transfusion is rare and usually happens when the prostate is very large. TURP syndrome, or TUR syndrome, occurs rarely. This occurs when too much fluid that is normally used to wash the prostate during TURP gets absorbed into the body. This syndrome usually lasts temporarily and can be treated with medication that removes excess water from the body. This syndrome does not happen when saline is used with a bipolar resectoscope. The risks of TURP also include scarring of the urethra, or urethral stricture, or the bladder neck contracture. This risk is rare. If this occurs, however, further treatment or surgery may be required to fix it. You may also need a repeated TURP. About 8 out of 100 men need to have another TURP after 5 years. Infection may also occur. However, this is a rare occurrence. TURP is effective in improving the voiding symptoms caused by an enlarged prostate, approximately 88% overall improvement. It is also considered the gold standard for the surgical management of BPH. Tissues from TURP can also be used to identify and examine cancers. Alternatives to TURP include watchful waiting, treatment with medication, transurethral microwave therapy, or TUMT, transurethral needle ablation, TUNA, transurethral incision of the prostate, TUIP, and open prostatectomy, an open surgery to remove the inside parts of the prostate. Please see the other articles and videos on eMediCore for more information regarding these alternatives. Let your physician know of any allergies you may have and of all the medications you are currently taking, including over-the-counter medications. If you are taking blood-thinning medications such as aspirin, Motrin, ibuprofen, naproxen, Plavix, or warfarin, ask your physician when you should stop taking these medications. Do not eat or drink anything after midnight, or at least 8 hours prior to the surgery. Usually, it is okay to take your regular medication with a few small sips of water. During a TURP, an anesthesiologist will administer general anesthesia or spinal anesthesia to keep you from experiencing discomfort during the procedure. Your doctor will then insert a resectoscope through your urethra and towards the bladder. A wire loop is then used to scrape off the obstructing prostate tissue. The pieces of the prostate will then be washed out with irrigation fluid and tested for the presence of cancer. After a TURP in the hospital, your doctor will insert a flexible tube called a Foley catheter into your bladder and put you on continuous bladder irrigation to watch the color of your urine and to prevent any blood from clotting. Intermittently, you may feel the urge to urinate. If the urge to urinate is strong or you have pain, you should call the nurse to check your catheter and give you medication. Your doctor will usually remove the Foley catheter after 1 to 2 days in the hospital. You will be able to urinate with a strong stream. For the rare instance in which you cannot urinate, a thinner Foley catheter will be inserted to drain the urine from your bladder. In that case, you can go home with the catheter and a small urine bag hidden underneath your pants and have it removed in your doctor's office. For the first few weeks after your TURP, you may expect to have the following symptoms, which will gradually get better with time. Some burning on urination, frequent urination, urgent urination with occasional leakage when needing to use the bathroom, and some bleeding in the urine, off and on, which may last for a month or so. In the first month or so after TURP, you should avoid straining, strenuous exercises, heavy lifting over 10 pounds, and constipation. You should drink plenty of water and eat more fruits and vegetables. You should also ask your doctor when you can have sex, return to work, and resume your over-the-counter pain relievers, such as aspirin and ibuprofen. You should call your doctor if you are unable to urinate, have a fever over 101 degrees Fahrenheit, or have shaking chills. You should also call your doctor if you have persistent pain or heavy bleeding.
eMediCore, core medical education, for everyone,
from everywhere.
Forever free.